Andri, nice to meet you today here. Can you tell a little bit about yourself? What do you do?
Sure. Nice to be with you as well. I'm a psychologist. I'm a systemic psychotherapist. I'm a certified parents trainer with the parents effectiveness model of Thomas Gordon, and I'm also a certified group facilitator.
And I know that you work a lot with parents, with couples.
I do.
So
I'm a parent myself. I am a partner myself. So these are two main, let's say, areas of interest.
Yeah. And I know that even from my own experience, but also from others, I know that many parents say that their relationships change somehow after they have a child.
Yes.
So why is this from your experience?
Well, because when they start, let's say, going out or setting up a life together, they have this contract with each other, a dual contract. Just the two of them, a contract of communication, a contract of enjoying, a contract of connecting, of interest together. When a new person comes, the contract has to change because there is another person included with his or her own needs. And this is when they have a shock because maybe they expect that let's say the old contract, like we say, it has to continue, but it doesn't because it needs to be adjusted. And it takes a while, I think, for parents to understand that we need to adjust the contract to fit the new person as well.
It's interesting what you're saying. You're saying about contract.
Yes,
what
this is very systemic.
Yeah, what does it actually mean?
It's a very systemic term. What we usually say, meaning when we say contract, is that consciously and subconsciously, when we meet somebody, we are giving each other, we are satisfying needs of each other, internal and existential and any other needs. So consciously and subconsciously, each person finds in his other half that they decide to make a family together somebody that they fulfill specific needs like communication, care, love, attention. Sometimes many needs are coming from unsatisfied needs from their old experiences or even their childhood. And usually the problems begin when people change or when their life changes and it cannot fit these needs. And then they start wondering what is going on. That's why we say, and many people, we listen to people saying, he doesn't love me like before, he was different before, we were not like this before. And in reality what we need to adjust is to adjust the way that to understand and accept, if we continue with the same person, what the other person can give, and to adjust what we can give to each other. Because it has to be like a win-win process, I guess. We're using the term contract a lot in the system.
Okay, now I understand. So, can you talk a little bit about what is emotionally focused therapy? What is this?
Emotional focused therapy is one of my favorites ever since I studied it while I was studying systemic psychotherapy as part of systemic psychotherapy. Well, actually, this model is based on the ground rule of emotions, of trusting each other, of seeing behind the behaviors. You see, for example, a vicious circle of a couple. If you just see the behavior, you just see two couples just throwing responsibility to each other, or everybody gets the feeling that they don't understand each other. But if you focus on what goes behind this circle, and that actually all this, let's say, when we are fighting with each other, actually what we are fighting is we are screaming out our needs. We're screaming out our basic questions we have with each other, like, do you want me? Are you still there? Do you love me? Can we be like before? So if both of the persons in the couple try to understand that behind this vicious circle, it's needs of each other, and they can get through these needs of each other, then a big issue of security can be solved and trust can be restored. It's also based on the fact that we are each person in the couple is responsible for their emotions, their actions, and their needs. So we're actually learning, we're teaching the couple to share their emotions, to take responsibility for their actions, so that they can also stop these circles
Of blame.
And to call out for their needs, because the other person cannot really understand if you don't share, and if you don't share in an emotional way, not by blaming each other. Oh, it's your fault that I don't have this, but I need this. So it's I think it's an amazing.
In the book Hold Me Tight, Sue Johnson is talking about 7 conversations.
Yes.
So can you tell a little bit what is this?
Sure. These are the 7 conversations that I usually use in therapy with couples, and actually it's 7 steps. Okay, some steps can enter into each other because they during the therapy, but the reality is that usually when the couple comes, they come into a very huge. They're upset. Usually they're having a lot of disputes and fights. So you need to start with the fights. They might start and they come and they say, "We are fighting all the time. How do we stop it?" These are the vicious circles. The circles that each of them feels that they're attacking each other. So the first conversation is how you stop these vicious circles, how you stop these circles of contrast. And what we're trying to teach the couples there is that the other person is not an enemy. Who is the bad one? Usually starts with somebody, and let's say one direction or one word or one comment, which the other person, based on his or her experiences or the stress between them, takes it as an attack, and then he might attack back, and then the other person can defend or get into these circles of silence, which are the worst, for me. And what we try to make them understand is what is hidden behind the comment or behind the defensive mechanism that the other person is using. And when we can understand exactly the emotions of our partner, and that let's say to take this circle with trust, which takes some time for them to get into this, then we can stop the circle. In the beginning, they're learning to stop it when they realize that this pattern goes on, and they can discuss this after. Which turns us to the second point, the second dialogue, which is we're calling it in Greek, it's called ευαίσθητο σημείο, sensitive. I don't know if I'm translating it correctly in English. It's a sensitive, let's say, point. Usually it's a sensitive point that always initiates the vicious circle to start. Like, for example, I remember one vicious circle in the very beginning of our relationship, when I just broke accidentally something, which for me it was quite traumatic, because as a child I was feeling I was clumsy. So my husband was just, be careful. And to me, I took it as an attack, and I attacked back. But because he knew the story, he took it, and he told me, relax, you're not a child, it's me, and I love you, and I didn't say it in a bad way. So couples are learning to catch each other's sensitive points, which can be old traumas or insecurities, which they are alert, they are getting open, even by just one word or one comment, which one person can take as a judgment or hitting on the trauma. And the second one is learning how to, let's say, how to do it again, how to reorganize the circle again. So let's say that if they see the whole dispute, they're learning to do it together. How would they do it differently? How could each one stop it earlier? And the fourth circle, the fourth dialogue, which is the most important for me, which is learning to ask. It's called Hold Me Tight, which is the name also of the book, and it's learning to ask for your needs. And why it's fourth on the row is because you need to get the trust that the other person is not the enemy in the vicious circle, so that you can trust to ask for your needs. So they're learning to ask specifically for their needs. Meaning needs. I don't say I need respect. Of course, everybody needs respect. I need love, but specifically, what respect means to you. What is the picture of respect? I need you, blah blah. Not to order me when you must ask something, but to tell me blah blah with please. It has to be like a very very specific request. So they're learning to do this with each other, and to keep it. To continuously to try to satisfy each other's needs. The fifth circle is forgiveness. When you're ready and open, you can forgive. And forgiveness means not just I'm sorry, but really trying to catch up and make an effort not to make, let's say, not to repeat the mistakes. I'm sorry, how can I do it right? The sixth circle is concerns the sexual life and touch, because usually most of the couples, when they're having issues, they're also noticing that their sexual life is done, or that they might tell me we're not kissing each other anymore like before, or he doesn't hold my hand anymore. So they're actually putting little. In the beginning it sounds a bit funny as well, because I'm telling them, do it as a routine, and they're like, what? Routine to kiss him when he comes home? What are you telling me? What is it? But it's like getting back the old routines and the touch. And of course you need to get the trust, and you need to get the feeling that you both want each other. That's why you have to pass through the other 6 dialogues. And the 7th is teaching the couples to it's actually called maintenance. So they're learning to maintain it. They're learning to keep their little years, their routines. They're learning to plan, but not in a stressful way. They're learning to be able to catch up when they see that. And they're actually learning to go on with their new, let's say, contract.
Next question, which I think many parents have: how can I prepare myself for the future and for the fact that our relationships will change anyway after having a child? And maybe there is something that the couple can do in advance, so they can be in a better place once they have a child, and they have maybe less friction in their relationships after this. Is there anything that people can do proactively?
Proactively, I think that it's what I said. We need to be alert that there will be a change. We need to accept of the fact that there will be a change. That it cannot be expected from us that we will have all the time we had before. We will be tired in the first months or years. We will be more needy. We will be more stressed, and this is something we need to expect. But to accept, first of all, the difference is very important. The second one is not to accept the fact that the difference will change the form of our. Not to accept the fact that we will lose the juice of our relationship. To always have in the back of the mind that we need to make routines. We need to make little, we say in Greek, teleturgies. And this is something that we need to have it from before in mind. That we need to be planning now for our meetings. We need to plan that after the baby sleeps, yes, this is the time to have a glass of wine or a cup of tea. We need to plan that proactively, that who's going to help us with the baby in case we need some time alone.
So what would be my first steps, for example, to reconnect back to the other person?
Request, talk. Usually we are expecting the other person to understand this need. Maybe he's too tired or too focused or too stressed, so he doesn't. So we need to ask for it. We need to first of all talk about our needs, and the second one is also we need also to initiate the step. If I'm allowed to give an example, I remember when there was this issue that we were so tired and so exhausted, we were finishing late, and he was younger, and we kind of lost this routine of this wine routine that I said before. And I used to tell to my teacher, I mean, he's downstairs. He was doing a lot of jobs, let's say, downstairs in the yard. And I'm waiting with the wine upstairs. So I was complaining about him, and she told me in a very calm way, so take the wine and go downstairs. So it was simple as that. Adjust your routine, let's say. So what I actually started to do is I took my wine and I started drinking it, let's say, with him while we were both doing jobs. So actually it's, first of all, is ask, communicate, but communicate in a way of taking responsibility of your emotions, not like it's your fault, you are not doing this, but I need this. I feel that we're getting lost. I feel that our relationship, creating this, making that person understand that is your feeling, asking and initiating as well. And always being, it's good always to observe, but not to stress. Sometimes when you know also too much, you are also stressing like, oh, this is happening, so I should be doing this and I'm not doing this. Relax, watch, ask, communicate, and maybe this routine can be replaced with another routine, as long as we keep the connection. But it's good to observe, and it's good not to put it under carpet, with a carpet. Yeah.
Sometimes people also say that after giving birth, and there is a good reason for this, the sexual life is changing. So what would be their important steps again, or points of attention for each of the partner, maybe for men as well, not only for women, to again reconnect and rebuild the connection in terms of sexual life?
Well, usually, everybody has the impression that it's the man who is stressed about this issue, but I have also seen it the other way around. I have also seen, women saying that, after the baby, he got too attached to the baby. No, seriously. And I think that it all starts again from understanding that there will be a process of adjustment, and we need to be patient, but we need to be alert not to leave it to draw for a long time. We need to make the time. Really try to. I know I'm talking a lot about routines. I'm not even cognitive. I'm not in a behavioristic way, but in a way of keeping time for the needs. I think that sometimes when the sexual life is affected, it's because the emotional life is also affected. A mother, let's say, or that feels that the partner is not very helpful, it's not contributing actually to the family life. She loses this trust and this bond and this connection. So there's the problem is somewhere else. When there is a lot of insecurity and a lot of mistrust, you cannot directly go to sex. That's why let's say also in emotional focus therapy, sex is let's say 6 in a row of a step. So I would say that it's very important to first of all, to start connecting emotionally, to have a night with them. If we're planning, let's say, okay, let's have a night of our own, and if we're still feeling stressed with each other and a bit not so attached, let's take it easy. Let's just hug, let's watch a movie, let's try to talk with each other, because you also need to build the connection and then go to the sexual part.
Is there anything that you think is important for men to pay attention towards, not in terms of sex, but generally this afterbirth experience, and maybe not even afterbirth, but just with the little kids, something that you think that men should be more open to, or maybe focus on, or pay attention to in terms of their relationships?
I think he should never forget that his wife is a woman. Because he should pay attention to complimenting and nourishing the female part of his partner. This is very important. This is how you keep admiration, and this is how you keep, let's say, the flame. If I don't feel I'm admired as a woman, and I don't mean just on the sexual part, oh, my husband's attractive, but for what I am, and not just a tired mommy with my hair up, and yes, I know, thank you, I'm a good mommy, I'm breastfeeding, or I'm doing that. it's lost, and also he loses it as well. He should also he should always remember that his wife is a woman. This also goes for the woman as well,
Okay.
for herself and also for her partner. That they should always compliment their female or male part, and they should always connect to this part as well.
So it's important to, not to switch to different roles, like now we mommy and papi, but also we actually first we are man and
Partners.
woman partners, and
Yes,
then we are
yes.
parents.
Yes,
say.
exactly.
This-
And the children, as they grow, they feel it, and it's the biggest, I think. Example. Usually, all the traumas I have from adults that they come to therapy. And they're talking about their relationship or individual issues. Is they're always referring to the relationship of their parents and how it was drifted through the years, and how they started disrespecting each other or not treating each other as partners. And the greatest example we can give is how we can be with each other.
To wrap up and to sort of conclude on everything that you said, from your experience as a psychotherapist, what would be really important for couples to keep in mind before they go and embark on the journey of becoming a parent?
Well, I think I'm going to repeat something that I said before, and I used it like a Bible during my journey as a partner and as a mother, which is again, first you, first then us, then all of us, which is very important to be working continuously on ourselves so we can recognize our changes and recognize our needs, recognize the other person's needs, and how you can be a whole. It's very important to focus on the couple as well, to be always alert and to be always keep the sparkle or change the sparkle, but anyway keep a sparkle. And you cannot do it if you don't feel satisfied and complete as a person. And these two substances will direct us to all of us, to the family. We cannot be, I believe, and from my experience as well, and from not just professionally, in order to be good, in order to feel good with ourselves and with our parents, to feel like we are trying our best and we're trying to give as much as we can emotionally and not only to our child. We need to go through the process of ourselves and our couple. If we're not happy, our child cannot be happy. We need to be happy for our child to be happy.
Yeah. Thank you, Andri. Thank you for this
you.
conversation.
It's a pleasure always.
Thank you.